I've come back to Sydney for a special anniversary. It's 25 years since I became a vet, and it was here it all started, in the harbour city. And it seems quite fitting that today I'm heading to a wildlife rescue centre to help another Aussie battler who needs my help. Hi there, Morgan, how you doing?
G'day Scott, how you going?
Yeah, very well, thanks.
Yeah, thanks for coming.
On Sydney's outskirts, Scott has come to assist wildlife carer Morgan with some rescued koalas.
This looks like lovely fodder for a big, fluffy, iconic Australian animal.
It certainly is. Let's hope they approve of the menu selection today.
Morgan is a neonatal nurse and spends most of his spare time volunteering at Wyre's Retreat, nursing sick koalas back to health.
How are koala populations getting on?
Koala numbers are plummeting across eastern Australia, and the number one reason is habitat destruction. We need to stop cutting down their trees. Without trees, we don't have koalas.
Koalas are in trouble. They've recently been reclassified as endangered from vulnerable, and they suffer with a bacterial condition called chlamydia, which reduces their fertility. So koalas are in a lot of danger. So, who have we got here?
So this is Monty.
Hi, Monty.
He's about a 5 to 7 year old koala that came in suffering from chlamydia.
Oh, really?
And he was in very poor body condition. So we had to feed him up so that he would be able to survive the course of antibiotics. And thankfully he survived, and he's no longer positive for chlamydia. But in the last couple of weeks, he's suddenly lost a lot of weight.
I see we've got some paste here. Does he kind of take his paste very well?
Loves it.
Oh, look, he's perked up no end. Look at this. Yes, look at the good stuff. Are you ready? And just sort of squirt it in?
From just underneath, that's right.
Just underneath, yeah. Oh, wow, good boy. What is this?
So this is just a supplement to go with his natural diet.
Yeah.
Just for the extra calories and extra vitamins.
Yeah, just to build him up a little bit.
Yeah, exactly. Certainly the weight loss itself is a really big concern, and we need to get to the underlying cause for this in the hope that we can turn him around.
I'd like to think you're holding my hand in the spirit of friendship, but I think he just wants the food. It's great to see that his chlamydia is improving. Have you got any other patients where the infection's active?
As a matter of fact, we do. Chlamydia is the number one reason that we get koalas into care, and next door we have young Will.
Hi, Will. Oh.
And as you can see, he's not very well.
So he's got a really pussy, crusty eye, hasn't he? So very classic of chlamydia.
Yes, he does. And you can probably notice too, his bottom's a little bit wet and
Yes.
damp.
Yeah.
So they call that wet tail, and that's again a symptom of the urogenital chlamydia.
One thing I can feel just by feeling his ribs, they're really prominent. I mean, this is not a well boy.
No, and it's clear that he's been in trouble for some time.
Yeah, well, it does sound like he needs a bit of veterinary attention, so we should
Definitely.
package him up and head off to Dr. Luke.
Yep, sounds great.
Hey, yeah, do you want to go to the doctors?
Scott and Morgan have brought both Will and Monty to see a vet who specialises in koalas and often treats the sick or injured residents from the Wyre's Retreat.
Sure, thank you.
So we've got 2 koalas for you. Dr. Luke is a vet that works with koalas a lot, and I'm a vet that lives in England, so clearly I don't work with koalas all the time, so it's really great to have an expert like Dr. Luke by my side. There's a very, very handsome chap, except for that very sore eye.
In this area we get koalas come in to care for a few different reasons. The main complaint is chlamydiosis, so a bacterial infection that affects their eyes, their urogenital tracts and their ability to breed. We'll have a look at that, see what we can do for him.
Great.
First, Scott and Luke are going to examine Monty to find out why he's gone off his food and lost a worrying amount of weight.
It's very ingenious koala weigh station. I love it. 5.6 kilograms of koala.
Next, Monty goes under a general anaesthetic so the vets can take a close look at his mouth.
Like an expectant mum. In order to examine Monty, we first need to give him an anaesthetic, so we gas him down. I kind of hold him like a baby, which is really quite nice. And once he's nicely anaesthetised, we can then get to grips with his physical exam.
He's got quite a lot of wear in his front 2 teeth there.
So he's an old boy.
Yeah, so that area of gingivitis there is abnormal.
So, I mean, there's definitely a hole there, a massive hole. Looking into Monty's mouth, there's quite a nasty area of infection. It's bleeding. There's basically a hole in his gum, and that's a cause of great concern. If we find an abscess, that would definitely explain his weight loss, because he just wouldn't be eating as much, right?
Yes, correct. If it is, the good thing is we can look at potentially taking the tooth out, which would make him much more comfortable.
Yeah, and then eat more, put on some weight, go out to the wild.
Yes, so we'll x-ray that and then we can have a better idea.
But all of a sudden, the ageing koala starts to deteriorate.
During the course of the anaesthetic and the examination of Monty, I noticed that suddenly he's stopped breathing. I then reach and feel his pulse, and I can't feel it. We immediately jump into action. We turn the anaesthetic off. We give him a fresh blast of oxygen, and I start to rub his chest. And I just don't know if this very sick boy is going to make it. You sure? Yeah. So his pulse is strengthened now, so that's good. Thankfully, his pulse starts to strengthen, he starts to breathe better. Monty's okay. Just a little scare there. So Morgan, how did it make you feel when your little man stopped breathing?
Always scary. It's nerve-wracking when you know that they're crashing and that they're sick. And there's always that very real chance that we may leave him here. And that's the end of it.
With everyone feeling relief,
Got good blood pressure, Morgan.
Excellent.
Scott can now take blood samples for testing. They should reveal if something more serious than dental problems is causing Monty's rapid weight loss.
In this case, there could be far more sinister things like cancer, for example.
Morgan is hoping he isn't forced to make a heartbreaking decision.
Is this the next thing we need to do before we wake up?
When we're looking at euthanizing an animal, it has to be an animal that we cannot treat, or an animal that is going to be in chronic pain. These things ethically we cannot release back into the wild, and the kindest thing in those instances is to put the animal to sleep.
An X-ray will reveal if a tooth abscess is the reason for Monty's poor condition.
I can see just here, there's just a little black spot there, so just almost like a little gap, but all the roots look pretty healthy.
Areas of plaque around the tooth to indicate that there's an abscess sitting behind there.
The good news is that although there is some pockets of pus and infection there, the tooth and the bone around the teeth are all nice and healthy. So that means there is a real glimmer of hope that at some point in the very near future, this guy might be a wild koala once more. There you go.
Hang on to that. That's it.
All right, just like mum.
After an optimistic outcome for Monty,
Good boy.
the team is hoping for a similar positive result as they begin treating young koala Will.
The nice man help you. Oh, did you just koala poo all over me? That's lovely. Very sharp. The shoulder blade's just a good indication of body condition, and he just doesn't have any.
Yeah, climbing and sort of moving tree to tree, he should have really good muscle tone there, which is completely lacking.
So those eyes are really nasty and sore, aren't they?
Yeah.
A very common symptom of chlamydia.
Yes, yeah, very.
How does he catch it?
So close contact, body fluids, sexual activity.
Chlamydia presents in koalas in two forms. It's urogenital, so it's just basically around the urinary system, but also it's an ocular and eye infection. Gosh, Will has really obvious signs of chlamydia. He's got very scabby, sore eyes that are very inflamed, and he's also got a very wet back end. And then on top of that, he's very thin, and he definitely needs some treatment. Boy.
If swabs of Will's eyes and rear end confirm chlamydia, he'll be immediately started on antibiotics under strict supervision.
Okay, thank you.
Because koalas rely on bacteria in their gut to break down the leaves, Sometimes the antibiotics we use to treat the chlamydia also affect those bacteria in the gut, which can cause fatal side effects. Next step is ultrasounding his bladder, assessing the thickness of the bladder wall.
As well as Will's stomach, other organs like his bladder could be so severely damaged by the disease that he can't be treated.
I honestly do feel like the pregnant mother now, getting the ultrasound. Is it a boy or a girl, Luke?
Alright, so this area here is his bladder, which does show some thickening.
Yep. The future's in doubt for Will because on ultrasound we could see that his bladder is quite thickened, and when the bladder wall is thicker than 7 millimeters in chlamydia patients, the chances of survival of that koala is very low. I mean, that looks really quite thickened, doesn't it? You may have to put it to sleep.
Yeah.
Luke continues the scan to get a precise measurement of the bladder wall, praying it falls below the 7 millimeter threshold that would mean the young koala has to be put down.
Yeah. So we'll do some measurements of that so we've got a bit of an idea.
The result from the ultrasound showed the amazing news that the bladder of Will was 6 millimeters, so he just got it in there. Thank goodness for that. And hopefully with some treatment, antibiotics and anti-inflammatories, that will come down further and this guy still has a fighting chance to return to the wild.
It's something that we can do and treat him with is a big relief for me.
And a real chance that he might be able to return to his mates in the wild.
Yeah, and of course this is what it's all about. That is always our end goal.
Well, we'll just hope for you, mate, won't we? Hey, because each one of you is just so important.
We're very grateful for people like Luke and Scott that take time out of their busy days to treat our wildlife. And they largely do it with no bill, which I think is just amazing. The situation is dire and we're really desperate. These guys are disappearing. And once they're gone, that's it, they're gone. We can't get them back again. Koalas are in serious, serious trouble. But what we can do is try and make a difference in our little corner. And we do that one koala at a time.
Still on a working holiday in Australia, Scott's paying his fellow vet Rob a surprise visit at his Sydney practice.
Hey Rob, how's it going? Good to see you, mate. You well?
I heard you were in town. What are you doing here?
Well, I thought that I would give you my day off.
Done deal. I've got lots to do. Come on, this way.
Okay, all right then, let's get to it.
Their first patient is 6-year-old Anna, who's due to give birth to her first litter. Owner Faye has had a love affair with German Shepherds for more than half a century.
Bred our first litter, I remember the date actually, 10th of August 1968 we had our first litter. And then just been breeding on ever since then.
All right.
Well, we got her pregnant. That's good. So we had an AI, Scott, and she had strictures, but I need to check and see if the strictures have gone. I don't think they have. A couple of days ago they were still present. Anna, she has a stricture that's literally the vaginal canal is just way too tight. We know things are too tight and they're not going to open up. A puppy will get stuck. That could kill the puppy and could even endanger her life.
Oh dear, he's donning a glove. That's never a good thing. Hey?
Rob will examine Anna to see if it's safe for the first-time mother to give birth naturally.
Yeah, no, she doesn't like it. It's too tight in there, Scotty. So,
All right, baby, that's all done. Good girl. There we
no
go.
choice here. No choice here. We'll do a cesarean. Okay.
So I think she's in that mode of going, you know what, I just want them out of me.
Yeah, that's right.
Yeah. How are you feeling about the cesarean? Are you worried at all?
No, not with Robert doing it. No.
There you go. There you go. Seal of approval.
Looking good.
It's good to hear. Well, I don't know, you're looking a bit nervous, but I'm sure it's going to be just fine. We'll do it for you. It's amazing to chat with Faye, a really experienced breeder. She's been doing this longer than I've been alive. So even though I'm a vet with a lot of experience, I think she's seen more puppies born than I have. So Faye, have you got a family sweepstake about how many puppies she's going to have?
No, not really.
Should we do one now? I'm going to say 10.
About 10, I have no Probably about 6 or so.
6? Okay. Rob?
I'm going for 7.
Okay, all right, so he's closer to you. All right, maybe I'm just wishful thinking. Rob and I will take care of it for you, and we'll take care of all these babies.
Yes.
And get them back to you as soon as we can.
See what they look like. Yeah.
I have a sense they're going to look like a German Shepherd.
Hope so.
Yeah.
I've known Faye since I was a kid. She was in German Shepherds then, and so was I. And she just loves her dog. Anna, she's got such a beautiful temperament.
Okay, good girl. Well done. Well, I know, baby. Okay. Sleep time now. When you wake up, you'll have lots of cute puppies.
As well as the surgical team, there's an interested onlooker in the theatre to see Anna become a mum.
So yeah, look, I've always brought owners in so they can be part of the process with their girl. It's really important. But with Faye, she's been through it quite a few times. She loves her dog so much.
In the UK, when I bring patients in with their owners, normally at the point of doing the surgery, the owners will exit stage left. But you are going to stay for the whole procedure?
Yes, if you're from allowed,
Yeah. I'm a bit shocked that Faye is in the operating theatre. A bit of a surprise. For anyone that knows caesareans, they're not pretty, they're very messy, but Faye seems to be completely fine about it. Have you seen one of these procedures performed before?
Yes. Her mother.
Her mother?
Yeah.
It's just amazing, I think. It's very brave. We don't even get you a seat. All right, well, I'm going to have to watch myself and do the best job possible. I'm feeling a bit of pressure now. Do you ever have any fainters?
Oh yes, it's usually the bigger guys, and you've got to tell them, as soon as you feel hot, please sit down. And they don't, and it's a hard floor. I tell them, very hard floor, and I won't be able to pick them up. I've got to do the work.
That's right, well, we're focused on the dogs.
Delivering Anna's babies will be a family affair for Rob.
Thank you.
Daughter Ainsley is a nurse in the practice.
Poke you in the
Technical skills are
eye.
amazing. Because you're working with your dad, you feel the need to just abuse him every time.
Sorry.
So who's on puppy catching duty today? You, 2, 3. Lovely.
With Anna expecting a large litter, Scott and Rob will need every available family and staff member for the job ahead.
Goodness me, Faye. Wow, there's more. Oh, look, there's our first one. Already got a movement there, Faye. Okay, girls, who's got this one? Okay, ready? Done. Caesareans, it's kind of a frenzy of activity. There's puppies being thrown in all different directions, but it's all to get the process done as quickly as possible. The key thing is we want to get those puppies out as soon as we can and get them breathing. The swinging is just about trying to empty their lungs of fluid to get them to start breathing. Oh, it's always amazing to have all the hands you can have. Generally, you have the nurses, and you have the other vets, and then you get the receptionist, and then you get the bloke walking down the road, and the lady walking with the trolley. Just any hands are good hands.
A lot easier because you were here. I tell you, you made life a lot better for him. We might keep him here in Australia. You may not be able to go home. More here.
More.
Yeah.
Oh, beautiful. Well done.
I've done heaps of caesareans in my time. One day I did 8 caesareans in one day, but what keeps me going is that you're bringing life into the world. It's magical.
How are we going, ladies? All breathing? They're coming out nice and healthy, and they're coming out thick and fast as well.
As the healthy puppy count rises, attention turns to who's ahead in the litter guessing sweepstakes.
How many's there?
1, 2, 3, 4, 5, 6, 7, 8, 9.
10.
Scott was the closest.
I think she must have known it was the first and last litter, so she'd really put it on. Oh my gosh.
All right, Dr. Scott won the sweepstakes.
Yeah.
You guessed 10. I was way down. I was on 7.
Absolutely rubbish. He's a great vet, he's just rubbish at choosing how many puppies there are. Hey, Ainsley, can I ask you, your dad, does he not like losing? It's sort of showing right now.
I always win, so he's
You always, oh, fine. Yeah, well, yeah, I'm sure. Someone's got to lose.
With all 10 of her offspring healthy, the focus now is how new mum Anna is faring after giving birth to such a mammoth litter.
How's she doing, Ainsley? All good? Okay. Faye, do you want to come and see your new puppies? Look at these.
Like 2 litres in one, isn't it?
You can pop your hand in there if you like. Oh, look at them. Hey? Wow. Oh, what a good mum. How many puppies do you think she was going to have?
About 6.
You must feel really embarrassed right now. Do you
I
feel
do,
embarrassed?
yes,
Yeah,
yes.
no, that's fair. That's
I
fair.
just thought they're probably big ones. Well, these are big too. So many.
They're so gorgeous. Look at them. I think it's amazing that Faye is in the operating theatre showing her Anna's gorgeous puppies. She does seem a little bit intimidated. She's got a lot of experience looking after puppies, but 10 is a lot.
Oxygen on.
1, 2, 3, go. Okay. Smooth girl. Yeah. So you can hear that beautiful sounds in the background. That's the sound of this gorgeous dog's puppy. So she's just recovering now, so it's a perfect time to put puppies on mum and give them their first drink.
2 boys, Scott.
Ah, lovely. Boys are always very hungry. Look, there's your mummy. There she is. Let's pop you on the milk bar. Yeah.
And still for me, after all these years, I love doing it. I love getting those puppies breathing, and then the mother accepts the puppies. You wait with her while she does that. Oh, it's just a beautiful feeling.
There you go. That one. It's lovely to see Anna recovering from the anaesthetic. Her puppies are taking their first sips of milk. Things are looking good for Anna's new beautiful family, and I'm sure together with Faye, enjoy a wonderful life. Hey, so Audrey, thanks for having me. I'm loving your clinic on wheels. It's very cool.
It's like my little mobile office.
Scott has teamed up with Sydney-based colleague Audrey for an unusual case not far from Bondi Beach.
First one off the rank is a really interesting patient
Okay.
with an interesting problem.
Right.
As a mobile vet, we see all types of patients, but today I've got a very special patient of mine. It's a bit of a tricky one, a little bit strange, so I've got Dr. Scott here with me to help me with this problem. It's a cat called Sooty who has a strange love affair with his emoji pillow.
Love affair.
Love affair,
What do
and
you
by
mean?
love affair, I mean a very inappropriate love affair with his pillow.
I'm really excited to be working alongside my veterinary colleague, Dr. Audrey. We are travelling to one of her patients who is producing some rather intriguing behaviours that her owner is quite concerned about. Ah, so this is Sooty's boudoir.
Yes, this is the main place of action.
And
and
there's
there's the
pillow.
cushion. Oh, it's a cool face emoji. He's looking a bit grumpy as well, isn't he? We've definitely interrupted him.
We love Sooty. He's a big part of the family. He's got such a big personality, but he has had a few little personality issues, I should say.
You're looking a bit sheepish there, mate.
He is, look at him.
Owner Cynthia is desperate for a solution to her 4-year-old's X-rated habits.
And how often is it happening?
Every second night or so.
Second night?
Wow.
Sooty will approach either an emoji pillow or my leg or an arm, and he will start humping. And he can become quite aggressive, especially if he puts his teeth on you to hold you in place, and I find it quite uncomfortable. And it's usually me that he does it to. He'll do it on the bed, on my leg,
Oh.
or on
Lovely.
my arm. I don't know if you can see that.
Cynthia shows them graphic evidence of what she's dealing with.
Wow.
Whilst it started off with just the pillow, it's now progressing to his owner's legs, his owner's arms, and it's becoming quite aggressive. So we really need to get to the bottom of it.
It's the thrusting that's just so wrong. It's just not right, is it? Oh my gosh, well, I've got a black cat and he's a male. Thankfully, no cushion bothering going on in the Miller household. Thank goodness for that. It is completely natural and human nature to laugh at something like this, but there generally is a serious medical or behavioural reason behind it. And so we need to then put our veterinary hats on. You've got a dog, a bouncy dog, in your environment. What other animals do you have here?
So we have Sooty and his sister Misty, and we have 2 little rats as well.
Wow.
How about outside? Is there any building work going on?
We did have a building out the back though, and now there's building down the road, so that might have something to do with it, that he can't roam as freely.
So he's a keen outdoor cat?
Yes.
So certainly a lot of environmental stress around that could be contributing to his anxiety or the need to try and gratify himself. Let's have a check over him. I think we want to rule out anything medical. So blood tests, urine tests, full physical exam.
Yeah. If we can catch him. Yes, wily little man. All right, well, should we try and go on the hunt for Sooty then?
I think
Let's
so.
do it.
Okay, come on then.
All right, you going to help us find him?
Come on, you. Yeah. Come on then, let's go. I know he's embarrassed.
Can you just tell him to come?
Come on.
Not too keen on all the attention, Sooty's done a runner.
Come on, buddy.
Sooty's run away, he's hiding under the bed, and obviously he's uncomfortable because we've intruded his private space, so it's going to be a bit of an effort to get him out from under the bed.
Now, you're small. Audrey, go on.
Oh, I probably could.
Go on. Go for it.
Tunnel flexibility.
You'll never get me out if I go in there. Come on. I'll pull you by the legs when you've got him, okay? You got him?
Yeah, got him.
You ready?
Yeah,
okay, I'm going to pull you by the legs.
Okay, go.
Ready?
Go.
That's it, you got him? Oh, she's got him. Okay, buddy.
Okay.
Here we go. Ready?
Train lots up here.
Okay. Bum in first. That's always the way to get a cat in a box.
Good job.
Yes. Well done. Normally in my veterinary practice, I'm surrounded by nurses in a clinical environment. And here I am with Audrey. And what am I doing? I am grappling underneath the bed and grabbing hold of a cat and then pulling it by the legs. So definitely not the normal day, but clearly it is for a mobile vet. I'm glad you're doing the heavy lifting, although I'd rather be carrying the cat.
Scott and Audrey will perform a general health check on the Persian cross before testing his blood and urine for any signs of a medical explanation for his unusual behaviour.
Yeah.
All right, let's start at the head end. How's your teeth, buddy? Okay.
Pretty good.
All right, you want to check out the back end?
Yeah, okay, so he's a bit on the nervous side, isn't he? So the good news is we've got a bladder.
Great.
So I'll be able to get a urine sample, so that's good. Now, can we just have a look at your man parts and just see if there's anything going on back here?
Grooming, look at that.
Yeah, so he's licking in that area for sure, isn't he? All right, buddy.
Okay, all right, hold on. All right, we'll put your happy pillow right there, okay?
Are you happy your pillow's here? Lick ears.
He's very happy the pillow's here.
Yeah, I mean, there's nothing abnormal.
Not blue.
No. It doesn't look sore or irritated or inflamed at all. It looks
Your man part's all right, buddy.
all normal. So I feel his male parts just to see, is he causing them injury as a result of this excessive rubbing, which he doesn't seem to be. But what we do find is that there is some patches of hair loss on his tummy. Now that would indicate it's more likely to be an anxious or a behavioural cause than a medical one.
All right, so we'll take some blood, take some urine and send that off to the lab.
Sounds like a good plan.
All right, buddy.
Right, should we do that? Yeah.
Although they suspect the 4-year-old's obsessive humping doesn't have a medical cause,
Do you want to do the blood or do you want to do the urine?
I'll do the urine as I'm at the back end.
You do the urine end. He's doing all that bit.
Scott and Audrey must rule it out before determining how to treat the disconcerting problem.
He's a good boy.
I'm taking blood from Sooty because I'm really interested to see if there's any hormonal abnormalities there. If he has high testosterone in his blood, that could explain why he's doing that sexual behaviour of humping. Thank you, buddy.
Boy, well done.
You're a good boy.
Good boy, well done.
Scott now takes a urine sample.
Good boy.
Is that me or the cat?
Both of you.
Oh,
Good
thank
job.
you.
Good boys.
Thank you.
Good boys.
Which should reveal if Sooty has an infection.
No glucose, he's not diabetic.
Okay, no signs of infection, which is good.
Yeah.
So, looking more behavioural.
Yeah, definitely. We finished with all the tests on Sooty. I think that it is a behavioural problem as a result of anxiety rather than a medical one. And hopefully with the results, we'll be able to produce a plan, which means that Sooty and that cushion have less of the intimate relationship that they're currently enjoying.
Right, let's go.
I'll take the patient. Come on, boy, let's bring you home.
The samples will be sent for analysis, and Audrey will be back to visit the family in a week with the results. And a week later, Audrey is about to give Cynthia the all-important results of Sooty's blood and urine tests.
I've got some results back for you. Now, it is bad news in the sense that we can't treat it because it's not a medical problem. Urine came back clear, there's no signs of infection. Bloods came back clear, there's nothing going on in the inside, and there's definitely no excess hormones or testosterone that might be causing the humping issue. So we're back to environmental, behavioural, those kind of things.
So I'm glad in a way that it's not medical. So there's nothing actually wrong with him, but then that puts the onus back on us to fix his environment. And we've been working on a few things, new toys, and just trying to get him a bit more sort of involved with the family.
So a lot of work to do in terms of toys and environment, but I think it's possible. With time, you'll find out what he likes to play with, where he likes to go, and then you can sort of modify from there. Unfortunately, it's not a quick fix for Sooty. We are looking at behavioural issues which take some time, some toys, some environmental enrichment, and I'll touch base with Cynthia in the future. But hopefully, we can stop this undesired behaviour. It's just not on Sooty.
And after a few weeks, there's good news. With extra toys to distract him and lots of TLC from the family, Sooty has stopped his bizarre behaviour and is much more settled.